Hello, my name is Al Ali, and I'm a professor of plastic surgery. I wanted to talk to you today about a study entitled Abdominal Panniculectomy, Determining the Impact of Diabetes on Complications and Risk Factors for Adverse Events. Obesity is the #1 healthcare issue of this century. It's very often associated with diabetes. As a matter of fact, the more a person is obese, the more likely they are to be diabetic. The best treatment that we know for obesity is bariatric surgery or weight loss surgery. Often, when these patients undergo bariatric surgery and lose weight, they will become non-diabetic. Unfortunately, not all of them, so some are still persistently diabetic. Now, they do get a great deal of benefit whether they're diabetic or not, but one of the side effects of this weight loss surgery is a lot of hanging skin all over the body, especially in the area of the front or the apron and the front of the body. The procedure that we're talking about in a study to remove this apron is called the panniculectomy. What the authors of this study wanted to find out is if the patient is still diabetic at the time of their panniculectomy, are they more likely to have complications? They used a very large database put together by the American College of Surgeons, and what they did find out is that the patients who are still diabetic had an increased rate of complications as compared to the non-diabetic group. Risks or complications like wound infections, readmissions to the hospital, stroke, even kidney failure. But the most commonly associated complication in this particular study was wound separation. So what's the take-home message of this study? Well, as we said earlier, obesity is a huge problem. Diabetes is very often associated with it. When patients do undergo bariatric surgery and they lose a lot of weight, if they're still diabetic at that point and they undergo panniculectomy or this apron removal, they're more likely to have complications. The authors do not imply that a plastic surgeon shouldn't do surgery on a diabetic. It's just that both the doctor and the patient should be aware of the potential complications and be willing to deal with them. Thank you very much.